will send that. All right. So thank you all for joining us today for the Alliance of Nurses for Healthy Environments Policy Advocacy Committee. As I mentioned, today will be recorded. My name is Sarah Bucic, and I'm with Annie. I'm a policy analyst, and we're also joined today with our Policy Advocacy Committee co-chairs, Atina Smina and Dr. Christina Watkins. We do encourage you to put questions in the chat for our speaker. There will be a question and answer portion after our speaker presents. Today, we'll be hearing from Max Sano, who is the Senior Policy and Coalitions Associate at Beyond Pesticides. Max holds a BA in Environmental Studies, Government and Middle East Studies at Franklin and Marshall College, and an MA in Food Studies, Policy and Advocacy at New York University. He represents Beyond Pesticides and coalitions across the United States and bridges connections with the broader climate movement. Max has years of experience in intersectional climate action, serving on the advisory board of Resilience Youth Network and founder of his climate storytelling training nonprofit, The Green Zine. His work has been recognized by the UN Food and Agriculture Organization, Riley's Way Foundation, the Udall Foundation, the Posse Foundation, and the Aspen Institute, among others. Today, Max is going to discuss the importance of pesticide elimination and the advancement of organic agriculture and land management for public health and human health, and provide us with updates on the latest developments that Beyond Pesticides has tracked in terms of appropriations and farm bill developments, including attempts from chemical corporations to strip a legal right and protections away from cancer victims and permit them to hide behind weak product labels based on previous human health risk assessments and carcinogenicity classifications, which is the failure to warn pesticide preemption. I am now going to turn it over to Max.
Thank you, Sarah, and welcome everybody. I will quickly share my screen so that I can begin the slideshow presentation part of this. Can everyone see my screen? Thumbs up.
Yes. We can still see your notes though, just.
How about now?
Perfect.
Thank you, Sarah. And I wanted to thank you all for the opportunity to speak to you today. Before introducing myself and getting started, I just want to thank you all as health professionals in service of others for the vital work that you do on a daily basis on the front lines of public health. I hope that after this presentation, you feel empowered as advocates for yourself, for your families, and for your patients. As Sarah mentioned, I'm the Senior Policy and Coalitions Associate at Beyond Pesticides, and I want to speak to you about the federal pesticide registration review process and how this relates to some of our federal and state priorities and coalition work that we've been seeing over the last few years. And so first, we were going to get started with just the basics of federal pesticide law, and that is the Federal Insecticide, Fungicide, and Rodenticide Act, or FIFRA. As part of FIFRA, every pesticide active ingredient has to go through a human health risk assessment when assessing and determining its label. As part of that, there are 4 steps to the human health risk assessment process. That's the hazard identification, dose response assessment, exposure assessment, and risk characterization. It's important to note that as part of this process, peer-reviewed and independent literature is not required. The EPA, the registrant has to submit its data to the EPA as part of the registration process, and so they are reliant on data provided by these companies. As an extension of that, we have been tracking the deficiencies in the regulatory system as noted by EPA Office of Inspector General, a report that came out last August that summarizes an ongoing list of open deficiencies, which includes EPA's failure to comply with standard operating procedures and requirements for the pesticide cancer assessment process for fumigant 13D, also known as TLON, including failure to explain the scientific approaches the agency took to arrive at their decision, failure to confirm that they reviewed all data provided to the agency, nor did they comply with various federal agency guidance on peer review of scientific literature. There's the failure of the Office of Enforcement and Compliance Assurance to verify EPA labs are complying with hazardous waste requirements, undermines the public's ability to trust the EPA risk assessment process in the first place. There is the agency's inability to develop required testing and effective system of internal controls for the endocrine disruptor screening program, such as developing a strategic document or performance measures it puts into the question the ability of the agency to function at a baseline level in terms of assessing public health risks for pesticides, even when 17 were flagged for additional testing back in 2015. No such testing has been carried out. According to the Office of Inspector General, the EPA does not have the ability to collect agricultural pesticide exposure incident data to measure the impact of the revised worker protection standard rule among farm workers. The agency relies on information assessed during pesticide reevaluations and from voluntary reporting databases. The EPA is working on improving its incident data system, but the agency stated that the improvements will not enable the collection of additional exposure data. There's other areas of misconduct that have also been emerged from independent journalism and investigative journalism, including the Merchants of Poison report, where it was determined that employees of pesticide manufacturers ghost wrote scientific papers to align with industry claims, the opening of front groups to discredit journalists and scientists, and the spending of upwards of $1 billion over a 5-year period for PR firms and disinformation campaigns. There was also the release of the Paraquat papers, similar to a story you've probably heard about fossil fuel companies. A cache of internal corporate documents dating back to the 1950s, reviewed by The Guardian, suggests that the public narrative put forward by Syngenta, which is the company that is responsible for the registration of Paraquat, and the corporate entities that preceded it has at times contradicted the company's own research and knowledge. And the documents show that insiders feared that they could face legal liability for long-term chronic effects of paraquat as long ago as 1975. One company scientist called the situation, quote, a quite terrible problem for which, quote, some plan could be made. And so in terms of heightened risk, one of these heightened risks in subpopulations are, of course, farm workers. There is a litany of peer-reviewed science associating pesticide exposure to heightened risk of various cancers, respiratory harms, cardiovascular disease, DNA damage, sleep disorders, among countless others as noted here. In terms of causality, admittedly, I am not in the medical field. However, the preponderance of evidence that our organization has identified in tracking peer-reviewed science for decades emphasizes our duty to protect the right to hold pesticide companies accountable for their harmful products. And I can refer you to our science, regulatory, and advocacy manager, Sarah Grantham, who has the responsibility of continuing this legacy of tracking the science through 2 databases that we continue to maintain, the Pesticide-Induced Disease Database and Gateway on Pesticide Hazards and Safe Pest Management. As part of this decades-long experience of communicating with farm workers and identifying the risks of pesticides across the board, we have advocated for the advancement of national organic standards. Organic law emerged after decades of advocacy from consumers, farmers, scientists, and farm workers, and was codified in the Organic Foods Production Act in 1991. And this established criteria for alternative systems for agricultural and non-agricultural contexts. The reason why we advocate for organic is sixfold. There is a clear and legal definition. There is a systems plan known as the Organic Action Plan that establishes baselines for management practices intended to create resiliency and prevent pests. Every organic certified farmer or business has to go through this action plan. There's a rigorous standard for allowed and prohibited substances with a mechanism for incorporating real-time data on hazards and alternatives into reevaluation of that allowed list. There is the certification and enforcement system managed by third parties, the process for public participation on a biannual basis with the National Organic Standards Board, and funding to ensure that these elements are carried out in a robust way. And as you can see, organic criteria can be and has been applied in the context of hospitals and land management there, public parks and playing fields, mosquito management, as well as what you would traditionally think of when it comes to organic standards through the National Organic Standards Board and keeping organic strong. Over the course of 40 years, the Rodale Institute engaged in a field study with initial findings published in 2020, with the overarching goal of, quote, addressing the barriers to the adoption of organic farming for farmers across the country. These trials found that organic systems are 3 to 6 times more profitable than conventional production after a 5-year transition period. The yields are competitive over the course of this period as well. Organic yields are also 40% higher than conventional in stressful drought periods, which with the emerging and ongoing climate crisis is important to note. Organic systems leach no toxic compounds into nearby waterways, unlike other forms of conventional pesticide-intensive farming. Organic systems on average use 35% less energy than conventional systems and emit 40% less carbon into the atmosphere. And it's important to follow up not just on the climate benefits and energy benefits, but also the health benefits. While these reference studies are US specific, there are plenty of studies conducted internationally that we review and cover in our daily news blog and catalog into relevant databases I mentioned as the Gateway and the PID database as appropriate. A 2023 study published in Environmental Health Perspectives finds that urinary levels of glyphosate significantly decreased through an organic diet for pregnant individuals living further than half a kilometer from an agricultural field. Similarly, a 2020 study published in Environmental Research found that glyphosate levels can be reduced up to 70% after just 1 week into a fully organic diet. And so the main crux of the conversation that I would want to speak to you about today is in terms of failure to warn, pesticide preemption, some of the Supreme Court decisions that have shaped the status quo, and why this is relevant to your patients and to folks that are in your networks in terms of protecting public health. And so we want to go very briefly into a bit more on the Federal Insecticide, Fungicide, and Rodenticide Act background. There's 3 stools to FIFRA. There's the registration of pesticide products, the labeling of pesticide products, and then the prohibition on misbranding. Section 3 forbids that you cannot forbids a pesticide from being distributed if it's not registered under EPA. And in doing so, as I mentioned earlier, it has to go through a human health risk assessment and a carcinogenicity classification to ensure that there's not cause for unreasonable adverse effects on humans or the environment. Similarly, when it comes to labeling, there is an explicit emphasis on Section 24B that labeling requirements cannot be in addition to or different from FIFRA when it comes to state warning labels or state level warning labels. In terms of the Section 2, labels must not be false, misleading, or lack adequate warnings. And this comes after a Supreme Court decision in 2005, emphasizing that state law enforceable if equivalent to and fully consistent with misbranding. As part of this, the companies have an obligation underneath state product liability law to warn about known risks of their products. That being said, if a company knows of risks, fails to warn users of these risks, and that failure to warn causes serious injury, then the company may be liable for the harm they cause. And courts have been consistent that this is equivalent to and fully consistent with FIFRA misbranding requirements. And if there isn't any other questions in terms of the legalese, I can also refer you to some of our legal experts that we collaborate with. I am not a lawyer, and so just want to make sure to emphasize that point as well. So you have in Section 2 of FIFRA that labels must not be false, misleading, or lack adequate warnings. And at the same time in Section 3 that pesticides must be registered and have an approved label before sale. The key takeaway here is that pesticide companies, if they know of the risks, have a duty to update their labels. And so in this era of anti-DEI and anti-environmental justice setting, coupled with the failure of FIFRA, as mentioned earlier, to adequately assess harms, and the lack of political will to reform FIFRA at this time, litigation is the legal backstop, the last line of defense to hold petrochemical pesticide manufacturers accountable. And so what is failure to warn? The National Agricultural Law Center defines failure to warn as alleging that a product manufacturer failed to provide adequate warnings or instructions about the safe use of a product. Bates v. Dow in 2005, a Supreme Court decision, emphasized that congressional intent does not close the door on failure to warn claims. That, in other words, Congress would have been clear here if they didn't want this legal avenue to be open in writing FIFRA. Moreover, in 1991, a Supreme Court decision emphasized that the state governments have the right to pass pesticide laws at the state level for state authority on pesticide preemption, like you see in California and other states. However, industry in turn went to these state legislatures and essentially took that right away for about 45 states at this point. And we see history repeating itself, and we'll go into that in further detail later in the presentation in terms of their state-by-state attempt to do this, not only in Farm Bill and appropriations, but also in the states. And similarly, the failure to warn claims exist beyond pesticides, as noted in Cipollone versus Liggett Group in 1992, where federally mandated cigarette warnings do not preempt the Cipollone's common law claims against cigarette manufacturers. A similar argument can be made in regard to pesticide manufacturers here. We see the playbook repeating itself. And so this brings us to this year, appropriations, fiscal year 2026. A little known provision in Interior EPA spending bill. There's 12 spending bills as part of the appropriations process, and the Interior EPA spending bill as part of that includes this section 453, where, quote, none of the funds made available by this or any other act, so that's FIFRA or any other act, so that could be other in statutes, may be used to issue or adopt any guidance or any policy, take any regulatory action, or, and this is the operative part, improve any labeling or change to such labeling that is inconsistent with or in any respect different from the conclusion of a human health assessment or carcinogenicity classification for pesticides. Bizarrely, under this language, EPA itself would be hamstrung in updating labels, even if the manufacturer requested a change on a more restrictive label. I'll repeat that section again. None of the funds made available by this or any other act may be used to issue or adopt any guidance or any policy or take any regulatory action without conducting, and this is not a quote anymore, without conducting an entirely new human health assessment, which we know takes no less than 4 years and sometimes over 12, according to EPA itself. Meanwhile, the courts have historically held that a company can always ask EPA to update the label to reflect risks, for example, like non-Hodgkin's lymphoma with Roundup. If the agency chose to act, the statutory language would prevent label changes without a long process, if at all. And so this brings us to the state-by-state battle that has been engaged the last year and a half to try to take away the failure to warn state law claims in different states, majority states, just states across the country. We've seen them originally show up in Iowa, Missouri, which in Missouri is the U.S. Headquarters for Bayer Monsanto, and Idaho, which in Idaho there's a phosphate mine, which is one of the base materials used in synthetic pesticide and fertilizer products. In Missouri, the standard bill was carried over, essentially communicating that a label provides sufficient warning, meaning that a failure to warn claim does not apply, based on existing human health assessments, which we know are flawed and undermined public ability to trust the label. Additionally, these bills were introduced and expanded in other states, including Florida, North Dakota, Georgia, Oklahoma, Montana, Mississippi, Tennessee, North Carolina, and Wyoming. As you can see, the green represents states where failure to warn bills did not pass, meaning failure to warn claims were protected, at least as of the end of this year's state legislative sessions. Unfortunately, in North Dakota and in Georgia, they were able to pass failure to warn bills, meaning that you cannot use state failure to warn claims in those states. The yellow in North Carolina represents a holding pattern. We are waiting to see if a failure to warn bill would be introduced in that state legislature. we've seen in that state in particular that they tried to insert that language into the annual state farm bill to put lawmakers in a more uncomfortable position, which in turn led to a public outcry in the Judiciary Committee where it was housed, where they heard from concerned citizens, including farmers and consumers, on this issue. In other states like Montana, it was a razor thin vote, only 4 vote margin of victory in this case on the defense. But in a lot of states, like in Oklahoma and Mississippi, in Wyoming, they weren't even able to get out of subcommittee because, frankly, there wasn't a lot of education about what the true effect of these bills could be in the long term, especially for cancer victims and other folks facing adverse health effects. And so we've seen this happen in an ongoing way in appropriations fight that's going on right now. We've seen it in the states, in 12 different states over the past 2 years. Earlier this year, there was an attempt during an EPA petition process where 11 attorneys general wrote to EPA to preempt states like California from implementing add-on warning labels for pesticide products. You've probably heard this as Proposition 65. Any attempt to do so moving forward underneath this rule, if approved, would be considered misbranding. As mentioned before, similar language has also appeared in last year's Farm Bill, where, quote, the language would say to prohibit a court from directly or indirectly imposing or continuing in effect any requirements or penalize or hold liable any entity for failing to comply with requirements with respect to labeling or packaging that is in addition to or different from labeling or packaging approved by the administrator of the EPA. Similarly, in last year's appropriations bill, there was a similar effort to undermine the ability for this legal argument, where it said none of the funds made available by this or any other act may be used to issue or adopt any guidance or any policy, take any regulatory action, or approve any labeling or change to such labeling that is inconsistent with or in any respect different from the conclusion of a human health assessment or carcinogenicity classification for a pesticide. And so today, what we're asking for Congress, from Congress, is fourfold. We're asking to reject the provision, Section 453, adopted in the House Interior EPA Appropriations and Full Appropriations Committee in the final House bill. We're asking for it to not be attached to the Senate side appropriations bill, which we've been successful with so far. The Senate side appropriations bill did not include Section 453 at the end of July, moving into this government shutdown, which creates a good leverage in terms of negotiations going into the next few weeks and months, potentially. We're also just asking for the rejection of Section 453 language to be incorporated in the final appropriations bill or in a continuing resolution that might be passed before that final appropriations bill. We're also asking for the rejection of any failure to warn or preemption language in a farm bill package that might advance going into this month, the skinny farm bill, as y'all may have heard, in the PREA reauthorization, which I can go into further details. It's in relation to the reauthorization of labels as it relates to certain pesticide products, or other federal legislation or rulemaking on the horizon. For example, the National Defense Spending Bill, there might be attempts, for example, to sneak it in through there, given the various attempts that have already been attempted. And so in terms of potential talking points, we want to make it clear that this is not just about one product, or it's not about just glyphosate or paraquat or neonicotinoids. It's about the future of 16,000 chemicals, from household weed killers to restricted use agricultural pesticides. This legislation would apply across the board. It gives companies a free pass, even when they conceal risks or fail to warn about dangers, as long as their label was once approved by EPA, which we know takes at least 15 years for the review of an existing active ingredient registration. Secondly, the EPA does not independently test these products. It relies on the manufacturers. In other words, federal law, as I mentioned earlier, allows pesticide manufacturers to submit their own safety studies. The EPA does not conduct its own testing and relies heavily on industry-submitted studies. And when companies manipulate or withhold critical data, as they've done in the past, this bill would still protect them. Immunity rewards companies for hiding the ball. This legislation eliminates accountability even when companies break the rules. It would override state protections, block juries from hearing the facts, and tie the hands of farmers and families when harm is caused. As y'all have probably heard in the news, there have been settlements up to the billions of dollars from pesticide manufacturers awarded by juries. And these would tie the hands of farmers and families when harm is caused, with illnesses linked to these pesticides, including, as I mentioned earlier, cancer, Parkinson's disease, infertility, developmental harm to children. If this becomes law, even when companies act unreasonably or deceptively, foreign companies couldn't be held responsible. In that note, it gives total immunity to Chinese military controlled pesticide giants, which might be a potential talking point more uh, salient for conservative audiences, as we've seen in various state level battles. ChemChina, which is a state-owned company the Pentagon identifies as a Chinese military entity, owns Syngenta, which sells paraquat and hundreds of other EPA regulated pesticides in the US, some of which are banned within China. If this bill passes, American families could be barred from suing a Chinese military-controlled company for harm caused by its dangerous products. Why would Congress protect China instead of American farmers and families? And lastly, these provisions would protect companies that destroy farmers' crops even when they lied to get EPA approval. Once again, if this bill passes, nothing will stop a company from pushing a new product they know is likely to drift or damage nearby fields, as we've seen with dicamba herbicide in many different Midwest states as it relates to soybean and corn. It could downplay the risks for the EPA to the EPA, get a label approved, and leave neighboring farmers with scorched crops, lost yields, and then no legal recourse. Even when livelihoods are wiped out, immunity means farmers would be stuck with the costs, not the companies who caused the damage. There's also some additional talking points not listed here that relate to effects that this would have specifically on farm workers. For example, it would uh, for example, one of the talking points that we've seen that we have found to be helpful is, well, when you say just read the label, it's not enough when the label is misleading, incomplete, or not even available in Spanish or the language of choice, as we've seen with many different pesticide products. We've also seen that fit for registration is not a defense, but as we've said, these bills let companies off the hook, as I've mentioned earlier. And so what I want to leave you here today is not feeling hopeless, but hopefully ways that you can take action and share this with your networks and communities. You can use the QR code in the slide by turning on your phone, clicking on the screen, and it'll bring you to our resource hub where we track failure to warn bills at the state legislatures. We track the health effects, the different state-specific information that might be helpful in terms of local coverage, national coverage, as well as some other potentially helpful resources. And if you would like to get involved in some of those other efforts I mentioned earlier in the call, you can look at the Keeping Organic Strong hub, which I can add some of these links as well to the chat after this component of the presentation. And you can become potentially an advocate for the Parks for a Sustainable Future program as well by clicking on that link. There's other resources as well, like the pesticide-induced disease database and the gateway databases. And so I can connect you with my colleague Sarah if that would be of interest in learning more about how to apply some of these tools to your advocacy. And just for transparency, here are the citations, and I can share these slides with you all as well as part of this, if that would be helpful.
That would be great. Thank you. Thank
Because
you.
I know that was a lot of information, and so I definitely want to make myself available for any questions that folks might have, and given the size of the group, perhaps a discussion.
Wonderful. Yes, we already have one question in the chat, and we have folks thanking you, saying that they use your resources from Beyond Pesticides. One of the first questions was, is there a farmers union, organization, or group that you all work with or collaborate with regarding your work? And how can we uplift their efforts and voices?
That's a really good question, and that's been part of our work is trying to engage with agricultural communities on this issue because frankly, environmentalists and farmers are always pitted against each other, especially in these fights. So part of our effort was to show Congress, our elected leaders, that we are in lockstep with farmers, with workers, with consumers. And so we've collaborated with various different organic farmer associations, including the Northeast Organic Farmers Associations for Massachusetts, for New York, Vermont, as well as the Northeast Organic Dairy Producers Association. We've been working with some other farmer partners within different states where these bills have showed up. For example, the Iowa Farmers Union is one of our partners in Iowa and emphasizing that farmer, and as well as Iowans for Responsible Agriculture, which is a does a lot of engagement around CAFO work in the state as well. So obviously, if there are more connections with other farmer groups, we would love to continue to educate and involve as many folks as possible. And I can send a link in the chat as well momentarily to that fact sheet. We got over 50 organizations, including Annie, to sign on to show that we are in lockstep as a community, that we want this, we need to defend this legal backstop. And thank you, Annie, for your leadership in that area.
Well, thank you for everything you're doing. This is great. And any links you can put in the chat would be great. There was another question. How can we, make this bite-sized for patient care? Organic can be difficult to access for low-income communities, but are there maybe like a top 10 foods that would be reasonable and most impactful? And another question, do organic foods also still have pesticides? And what's the difference?
Great questions. I'll start with the first one, which this is something that we've tried to make tangible for folks because it's very easy to get lost in the talk around active ingredients, different chemicals. There's a tool I can provide, and I'll stop sharing my screen momentarily so I can actually start putting in some of these links as we're answering questions. But we have a tool called the Eating with a Conscience tool, where we have over 90 different individual products. So from agave to winter squash, where you can see the amount of pesticide residues that can be found in non-organic versions of those products to emphasize and heighten the contradictions, if you will, in terms of showing what those potential benefits could be. And do you mind repeating the second question? I apologize.
Sure. And Atenis, if you want to come off of mute, you can also do that if it's easier.
Yeah. Thank you for the presentation. I thought it was really great and helpful. And I was just trying to come from a lens of patient care and how difficult it is to access organic foods. And obviously if people could just eat wholesome foods, then that's better than processed foods. But taking that step further of identifying which organics. So I think that resource would be really helpful. My other question is that and this may be just my lack of understanding or knowledge, but I thought organic food also had some pesticides, maybe limited or certain, maybe it doesn't include certain chemicals. I could be wrong. So I just wanted to better understand uh, the difference between the load of pesticides in organic food versus non-organic, or if that's just a complete false statement.
Well, I appreciate that. It's really important that we're kind of continuing to educate on this because there is a misconception that organic has no pesticides, at least in the context of federal organic law. However, there are safeguards and rigorous safeguards, if you will, to ensure that it is worth the price premium that you're paying for. For example, organic standards have the national list of allowed and prohibited substances. And so that delineates the allowed and not allowed substances. And so you can see yourself the types of products that are allowed to be used. And we are the first to, as part of the National Organic Standards Board process on a biannual basis, go to the board and ask for certain materials that we've identified as potentially harmful or undermining the label to be removed. Copper sulfate being a prime example of that for rice patties, and it's used in rice patties, but also in other contexts as well. But there are peer-reviewed science on the health effects potentially of copper sulfate, which is allowed in organic. However, the difference with organic is that you have to go through, as I mentioned earlier, an organic systems plan where you have to rationalize why you're using a pesticide or using a specific material that may not be 100% the best in the world, but it is there are these systems in place as part of the organic certification that encourage the businesses, encourage the farmers that are involved to really dig into why they need to use those for certain pest pressures or other considerations. And so just in terms of communicating the benefits of organic, it's night and day in terms of what the EPA process is when it comes to reviewing peer-reviewed science of these materials used in agriculture and non-agriculture, once again in the context of pest management.
Perfect. Thank you so much.
Thanks, Max, and thank you for those great questions, Atinas. I guess I had a question, and I want to make sure other folks, if they have a question, please raise your hand or put it in the chat. But one of my questions was, and this reminds me of a lot of other toxics things, that I was really surprised when you first started that a lot of things that you would think would be regulated are not. What role can nurses play as far as educating our? Do you find in speaking with legislators that they perhaps believe that things are, regulated more than they are? Or is there a way that we can add our voice to educate our decision makers?
That's a really great question. I think that it really helps to hear from the medical community what the real life implications are for folks that are dealing with these chronic health effects. And while at the same time emphasizing that we have to be careful when it comes to causality, right? And so I think that what I would hope would be from elected officials the respect that they have for the medical community and for nurses, to kind of speak to that lived experience and backing it up with some of the science that we do have in terms of that. And so, frankly, having more nurse advocates showing up to testify, bringing their patients, if comfortable, to kind of share what it is to live with some of these adverse health effects, I think would really help to personalize and humanize this rather than just me going through or advocates like me going through the legalese, which obviously is important for understanding why we're fighting for this, but we need to make sure that we're grounding this in people and why and the environment and why and what we're trying to protect. And so at least off the top of my head, those are some ways that I think nurse practitioners should get involved. And actually to that point, a medical student, I believe in Missouri, was one of the folks that actually testified against the failure to warn bill, coming from his perspective as someone studying to become a doctor, to become a medical professional. And that I think really helped with some lawmakers to maybe depoliticize it a little bit too.
That's great. Thank you so much. Were there any other questions? And I see, Max, you put the resources in the chat. Thank you. And we'll send those out as well when we send out the recording. But did anyone else
I
have
have a
questions?
quick question there. Thanks. Max, quick question. When it comes to food labeling, we get a lot of food from outside the US. How does labeling, or how do these foods comply, or how do they comply with organic labeling if they're coming from outside? We get a lot of food from Mexico, from Chile, other places.
I'm really glad that you asked that question. It actually coincidentally came up earlier today when trying to talk with some of our international partners that are doing work on fertilizer issues, because USDA the US through international trade partners have what are called equivalency standards when it comes to organic. And so we have the USDA currently has organic equivalency, meaning that the standards of those governments match at the baseline what US organic standards are. And that is including Canada, the European Union, and all the member states involved there, Japan, South Korea, Switzerland, Taiwan, and the United Kingdom. Obviously, there are other parts of the globe that have organic standards as well, including Australia is actually one of the biggest percentages of organic certified farmland as a share of the whole farmland in the globe. There's also a lot of growing interest among agroecological advocates to bundle their food production into these producer groups so they can bundle their produce and then sell onto international markets. And so, at least in terms of the US equivalencies, if there's a concern around equivalencies or rigor of those standards, I would refer to some of those in terms of the international trade.
Got it. Thank you for, I'm glad we have some of those set up with our partners. But one more question about labeling. So that you're specifically talking about like the USDA organic label, correct?
Yes, the USDA organic seal.
Okay, because I know there's other organic organizations that certify food, and I've, I'm by no means very knowledgeable, but I know that there has been some like pay to play kind of innuendos in the past, maybe. And I was just wondering if you could speak to that a little bit. Just I'm sure I think for myself and for other patients, for just people in general, it can be confusing.
Thank you for bringing that up because part of our work is trying to counter greenwashing at all times as much as possible. And to clarify, you have the USDA organic label, but then you also have add-on labels that you have as a farmer or a business, you have to oblige and be USDA organic certified. And then you also have to go through the control mechanisms for that add-on label. And two labels that we've seen to follow that are the Real Organic Project label, excuse me, and then the regenerative organic certified label, which takes into consideration some of the soil health, labor, and other considerations that we would obviously love to see as part of the baseline. But given where things are in Congress, these are sort of kind of from the grassroots while also trying to protect the rigor of organic. We've seen that the term regenerative, while being important and galvanizing a broader swath of the public to care about sustainable food systems, is racked with greenwashing and industry co-option. In fact, there's a study came out funded by CropLife America, which is the lead lobbying entity for pesticide manufacturers in this country, promoting a definition of regenerative underneath integrated pest management or IPM, which would inherently undermine the organic seal and the further expansion of organic standards. And this is an issue that we have been trying to engage the regenerative community, the regenerative organic community, as well as the broader public who might not be tracking this as closely as we are, because we want to make sure that as regenerative grows as a community, that it's not undermining the baseline of organic standards that we need and that the consumers trust. As we know, organic standards, the USDA organic seal is the only legally defined form of sustainable agriculture in the United States. And so that's where a lot of our impetus comes from. We know it's not a perfect system, but it's one that's been fought for decades and needs to continue to be fought for. It's not guaranteed.
Thank you so much. This is so much great information. I know folks will probably have some questions once they kind of, think about a lot of the things you've discussed. If you'd be willing to share your contact information, that would be great as well. And we can definitely, thanks for sharing your slides. Were there any other questions that folks had? All right. Well, we really appreciate you. Yeah, go ahead, Max.
I will also quickly flag, and I can send a follow-up as part of the follow-up to this. The National Organic Standards Board does have its fall meeting on the first week of November, and the public are able to submit comments about what they want to see from organic standards moving on. This is a process that many don't know about, but it happens every 6 months, and the recommendations of the NOSB are binding, meaning the Secretary of Ag is legally forced to comply, which is very different than other federal advisory boards under FACA law. And so if there's a petition or an idea that the medical or nursing community wants to raise to the board, that way they know and can then think about it and implement it in future meetings, it's very different than the FIFRA process where there's very little transparency, and the process for re-registration, as I mentioned, can be up to 15 years. So had to flag that just because of the timeliness. We're still waiting to hear back about how the government shutdown would affect this process, but just wanted to raise that.
That's great. And that would be great if you could share that information with us. That would be something I'm sure some folks would be interested in speaking up about. Well, there's definitely lots of positive feedback in the chat. Thank you so much, Max, for sharing with us all the great work Beyond Pesticides is doing. Thank you so much to everyone who joined today. I will send out the recording of this along with the links and the slides. And I guess we will see you all again next month for the next meeting.
Thank you, everyone. Bye.
Thank you.
Thank
Thanks,
you all for
everyone.
having
Take
me.
care. Thanks, Max.